Welcome back to the Zero Hour with RJ Eskow. I am Alex Lawson, sitting in for RJ, and I am really, really excited to be speaking with Jennifer Reid from Doctors Without Borders, Médecins Sans Frontières, an organization who I just have so much respect for Doctors Without Borders. It's the work that y'all do is absolutely amazing. So I want to open this segment with my effusive praise for the work that you do around the world in some of the absolute most difficult environments that exist around the globe, delivering health in times of war and crisis and disaster. Really, Doctors Without Borders is an organization and people that that everyone should just be thankful that y'all exist and are willing to do the work that you do. And I think it's fair to say, driven by a fundamental moral vision that the right to health is universal. So, Jennifer, thanks so much for joining us here on the program.
Oh, thank you so much for such an introduction. I'm very happy to get to have a chance to chat to you today. So thank you for inviting us to speak.
It's always sometimes hard being introduced so effusively, I know. So I somewhat apologize for it, but I really do mean it. Anyone who doesn't know Doctors Without Borders work, just Google it, go to the website and look into what you all do day in and day out. Do you think it's fair? Do you think it's fair to say that the drive of Médecins Sans Frontières is a moral vision of that universal access to health, that health is a human right? Do you think that's fair?
So MSF is, for people who aren't familiar, an international medical humanitarian organization. So we're working to provide care to people affected by armed conflicts, epidemics, natural disasters, and exclusion from healthcare. And it's about really trying to reach people who are being missed for any of those reasons or beyond. And so we're currently working in about 70 countries around the world. That includes responding to things like the Ebola outbreak in West Africa, responding to the Nepal earthquake last year, also working in more stable contexts like HIV and TB treatment programs that we have in a number of countries as well.
So I want to focus on one of your campaigns, but kind of laying it out that so a natural disaster or an open armed conflict or a serious outbreak, an epidemic like Ebola that you brought up. They're somewhat acute things, right? Are emergencies in a way that you can kind of understand how they could overwhelm access to healthcare or break down supply chains or things like that. And MSF is going to get into these places and try to keep this access going. But there's another way of restricting access. There's another thing that's happening all the time that is the focus of your campaign, Lives on the Edge, that I want to talk about. And on the Zero Hour, we've been doing a series on this, and we'll continue to do a series on this and shine a light on a more mundane restriction of access to health that is actually pawned off as a business model. And that is what the pharmaceutical corporations in America and then what they promulgate all around the world do to restrict access to medicines for profit. So the current setup of pharmaceutical drugs is actually in a place where millions of people who need the access most are not able to get the drugs that they need.
Yeah, so I think that's a good segue into the Lives on the Edge report. Thank you. Basically, wherever MSF is working in conflicts, in short-term emergencies, or in the more stable context, we need access to affordable, quality medicines drugs, vaccines, diagnostics. And basically, why we have issued this Lives on the Edge report is to kind of shine a light on the way that pharmaceutical research and development can affect this access to medicines, how we pay for and encourage research and development, where that's failing to deliver what we need, and government's highlighting the government's responsibilities to fix the problems, recognizing that this is a lot to do with the way that the rules are set, the incentives and the regulations that drive the research and development system, and leave us with these gaps, basically, of products that either don't exist that we need, products that exist but are unaffordable, or products that exist but don't work well in some of the resource-limited settings where MSF is working, like when we're trying to provide immunization campaigns and vaccines that require really strict refrigeration requirements. That's pretty difficult when electricity is unreliable, or when you're trying to reach some of the more remote places where we're working. All of this are things that could be addressed better, we think, with incentives and the way that we drive research and development in a way that can focus on priority health needs, delivering basically the tools that we need, the way that we need them, and affordably.
So let's go over just a little bit here how it currently works. In America, almost universally, the basic research is all funded by taxpayer dollars. After the basic research, it's still a huge percentage of the research is still funded by taxpayer dollars, whether it's at the NIH or through grants to university. It's really the taxpayers who are funding a lot of this research. But then there's this weird thing that happens where we basically give this research away to pharmaceutical corporations who then can make as much money as they want on it. There are actually no restrictions on the use of these monopolies granted either through patents or through other mechanisms. But these corporations then decide basically what you're going to see on the market. And so I think a way that our listeners can really understand this is, if a person here in America is watching any sports, if you're watching football, you're going to see about 7 commercials for Viagra and Viagra-like drugs, right? There's going to be all of these companies are competing to create drugs like that, where there are whole lists of drugs whose disease burdens are leading to, increased longevity, life expectancy all around the world, just millions of deaths, and yet there's no research into these diseases and the medicines that can be used to cure or treat them. Or if there is research, it kind of gets stranded along the way because the incentive structure is to really get these companies to make as much money as possible off these bonanza drugs that are primarily marketed in Western markets. So what do you think we can do to shift away to a different incentive structure?
Yeah, so I think that we see a lot of the same issues we highlight that in our report as well. There's a lot of public funding that does go into research and development currently. We have some numbers of that. And then in terms of other sources of funding also that contribute to research and development, governments have some rules and regulations that they don't use as well as they could. They could have more and better ways to manage that, and they could certainly be making sure that we get more for the public money, more public access for public money, and could also be making sure that that's resulting in the kind of the products that we need. So agree, looking more at priority public health needs, let that set the priorities rather than a kind of look at the markets or expectations of high profits. And so that kind of, I agree from MSF perspective on a lot of the key challenges.
So one thing that we could do almost immediately
for making sure that when products are developed that they're made affordable and available across the board. And in terms of what could we be doing, our report is hoping to kind of contribute to the conversations of how we could be doing things differently, how we could be doing things better to get the medicines, vaccines, and diagnostics that we all need. There should be, we look at transparency and the lack of transparency currently in the system. We're asking for changes in the incentives. So stop pursuing damaging policies, stop with push for more monopolies and further delaying access to competition. Competition is a proven way to decrease prices and increase access. So MSF saw that when we were working, when we first began treating people living with HIV treatments that cost more than $10,000 per person per year to do so. And it was really thanks to generic competition that the prices have dropped dramatically. Today, those same medicines, the prices have dropped about 99%.
So one thing that I think we've kind of focused on in some of our coverage of this issue is this idea that when there's this public funding of research and then it's transferred into the private sector with basically no restrictions on it, just like that's the only way that it can occur, but that's not at all the only way it can occur. It is also very possible to put some restrictions on those patents. So if there's a new drug developed and it is given over to a private company, it is not given to that private company so that they can use it to make as much money as possible, even if that means that very few people have access to that drug. The point of the patent is not to make as much money as possible for a company. It's actually so that this invention, this drug, can get out into the world to those people who need it. And so it's very easy to put restrictions on that. Affordability and access restrictions, for example. And I know you talk about that in your report some, and there is actually some movement right now in the public discussion here in the United States around this in the presidential election. It's basically that pharma is so greedy that they're going to choke on their own greed because the American people are sick and tired of paying for the drugs basically three times. We pay to develop them with the research. We pay to patent and then protect those patents, and then to go through these terrible trade deals around the world and even push more patent exclusivity. And then we pay the highest prices in the world here in America. So I know your work is around the world, but I think that we agree that if we could actually do something on high prices here in America, that our system here is probably the fundamentally broken one that is exporting these high prices around the world and contributing to this lack of access to life-saving and vital drugs and medicines. What do you think, just in terms of I won't ask it. I think that where people will see, and there's been some high-level discussions in multilaterals, that the next thing coming down that no one is really paying enough attention to is antibiotic resistance. That we need to be creating new antibiotics right now, or we're just not going to be able to deal with the threats in the future. In the last 2 minutes here, what do you see as the biggest challenges facing the global health?
That's a good question. So let's see. I think, we definitely agree on going back to what you said just a minute ago about putting conditions on the public funding. Overall, it's about 30% of the R&D is from public sources, and then an additional 10% from private or philanthropic donations. And we could be having conditions on that. I think there's a lot of options on what could be done differently. Put conditions on public funding, make public incentives like the priority review voucher for neglected diseases work better. What we do have, make it work better. stop exporting the kind of damaging rules that lead to these high prices and the innovation gaps, like you see in the Trans-Pacific Partnership Trade Agreement. And yeah, look at ways to incentivize innovation for things like antibiotic resistance and other sort of priority health needs that are left out of the equation right now. So the biggest challenge, I think, is going to be about how can we kind of right the ship and put the right kinds of conditions and incentives on the research and development that's happening and make sure that it works better. So I think there are a lot of choices and a lot of options and a lot of discussion in the U.S. and internationally about how that could be done, and we're happy to be contributing to that conversation with our Lives on the Edge report and moving up beyond that to make sure that the research and development is really focused on people's health needs, on patients, and on health.
Jennifer Reid with Doctors Without Borders, Médecins Sans Frontières. Thank you so much for joining us here on the Zero Hour with RJ Eskow. I'm Alex Lawson sitting in for RJ, and we will be right back after this.